Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. Today we have a renowned gynecologist who is specialized in robotic surgery, and also she is a Guinness World Record holder, and she is going to explain to us what is PCOD. Because today, wherever we go, youngsters, when we meet, they say, why are you like this? Then they say, oh, I have PCOD, ma'am, I have PCOD. So each one is worried about PCOD. What is this PCOD, Dr. Parimala?
Good morning, madam. It's my pleasure to meet you and wish you always as my teacher who has taught me
Thank you.
ABCD of medicine in few years back. Now, the very important topic you have chosen, madam, today, polycystic ovary. I'm very happy because at least the 1 in 5 girls who come to our OPD, it
Hmm.
can be ultrasonologically they will bring a paper only. So many times they will have already understood
Hmm.
that they have polycystic ovary. They will
Hmm.
come straight away, come and tell themselves, college girls, or if they are very young teenage girls, their mother will bring them and tell this girl, my daughter is not having periods regularly, madam, or she is
Hmm.
becoming very fat. She's
Hmm.
having lot of pimples. Whatever we do, like she takes care of her bath, everything, but pimples are not going. And I have restricted
Hmm.
her oil food also these days. They will really be worried. This is all
Hmm.
because of there can be lot of problems in the ovary where the eggs are produced. Just to make it
Hmm.
more clear to our the audience, the ovaries are two usually. The ovary will have
Hmm.
some one or two follicles every month growing, and one of the egg
Hmm.
will usually mature and dissolve and become the menstruation. But in polycystic
Hmm.
ovary, what happens? This ovary will be full of eggs. Polycystic. The word itself
Hmm.
is self-meaning. Poly means many. Cyst
Many.
means they are not cyst. Actually, they are something like a fluid-filled places. We can say there will be many. They are all
Okay.
nothing but small eggs actually. So in a
Okay.
the ovary, because it has got many eggs, one egg maturity will not be there. Many of the eggs will be there, but none will become a good egg, ovulation or
Hmm.
anything. So it will produce lot of these hormonal endocrine disorder. The main
Okay.
hormone which is supposed to give the FSH level and LH level will become deranged there. So because of that,
Okay.
there will be insulin resistance developing because polycystic ovary is nothing but it's an endocrinal and metabolic disorder, we can say. It can
Hmm.
be hereditary also, it can be their overweight also, or it can be their
Hmm.
stress also. All these
Hmm.
things can lead to polycystic ovary. But what will
Hmm.
happen in the young girls of some 14 years, 15 years? They are just
Hmm.
children actually. They are so much taken
Okay.
care. But in
I
that
know.
also polycystic ovary, because sometimes the genetical factors also may be playing and their lifestyle
Okay.
may be very like not up to the mark. They may not
Hmm.
be
Hmm.
following a good diet. They may not be
Hmm.
following a good rest or anything. Because of
Hmm.
that, there will be a lot of derangement in the metabolic hormones, especially in the
Hmm.
liver metabolism. It is
Okay. Okay.
very later when said whether it is from the chick comes out of egg or egg will give rise to chick. Like that, whether
Correct.
polycystic ovary is because of the liver metabolism problem or liver metabolism is deranged because of polycystic ovaries is still a mysterious mechanism for us. So in
Hmm.
what happens in liver, lot of toxin detoxification happens in liver actually. We all
Yes.
know that even some person with general knowledge also liver is a metabolic disorder correcting organ. It's like a
Yeah.
municipality which will correct all our toxins and detoxify us. When liver
Okay.
deposit lot of fat in the its structure, then there can be derangement of the
Like
metabolic.
fatty liver, can the fatty liver also be part of this PCOD?
Yes,
The
yes, it will be
fatty
most
liver?
of the time. Yes, most of the
But
time.
many a times the fatty liver may be because of the dietary intake, or it could be due to alcoholic consumption.
Yes,
So
yes, yes,
nowadays the girls are consuming alcohol. So is
yes,
it a
yes,
warning for them to keep their liver fit so that no
yes,
they
yes,
don't get the
yes.
endocrinal problems?
Correct, correct. That's a very important message, madam. But here, what happens because of the obesity, the liver can
Hmm.
catch up with a lot of fatty, grade 1 fatty degeneration, grade 2 fatty degeneration. In turn
Hmm.
of that, there can be insulin resistance from the pancreas also. Even though
Okay.
pancreas is producing insulin, which is very important to keep the liver very healthy. But
Okay.
insulin resistance is there because of the increased steroids which are produced in the body because of the
Okay.
obesity. The
Okay.
obesity will nothing but the extra fat will convert into steroids. Steroids will
Ah,
detoxify it will toxify the liver,
ah,
degeneration, and also insulin resistance. Because of
ah.
insulin resistance, girl will put on more and more weight because
Wait,
her
well,
carbohydrate metabolism is deranged. It is
yeah,
not
yeah.
possible for her. So because of that, these fatty increased androgen production also. The male
Hmm.
hormone also starts increasing. All this
Increasing.
steroid effect.
And
Because
the
of that,
female
she developed
hormones
the
come
hairs.
down.
Uh,
Yeah.
yeah, she will develop hairs. She will develop pimples and even
Hmm.
the hair loss from the scalp also. That is one of the
Okay.
very distressing factor that girls will run and come. Mothers also like 25, 26 years also can have PCOS. They also will tell
Okay.
after delivery we had a lot of hair loss. Madam, again, my child is 2 years. I am not pregnant. Still, my hair loss is going on. They
Oh, oh,
polycystic ovary because they might have become obese in this interval period
yeah.
because they are
Dr.
not able to
Parimala, is
take care
it,
of.
yeah, yeah, is it a preventable condition or is it because of
Definitely, madam.
the
Definitely.
bad habits or their lifestyle has changed? What is responsible for this?
Definitely, it is a preventable condition. It is
Hmm.
something like they have to be very careful about their diet, their
Hmm.
way of sleeping, their
Hmm.
anxiety. This one, some of our professionals are so much into the anxiety, especially IT
Hmm.
professionals. They are into this biological shift. They work the
Yeah,
whole night because of the
night.
Western country standard. So their
Hmm.
sleeping pattern, their eating pattern, everything changes. So that
Yeah.
anxiety and biological clock pattern, when it is changed, they can be definitely a prey for polycystic ovarian syndrome. So all
Ah,
these things are
yeah.
to be taken care. Sometimes they come to us and they tell, Madam, my duty starts yesterday night in the 10 o'clock, morning 8 o'clock it gets over. Then we tell,
Hmm.
unless you correct this, it is very difficult. Then they ask, then we
And
have
when
to,
they're working, they'll be taking coffee and they'll be eating,
yes,
they'll be
yes, all
munching,
those
they'll
things,
be
yes.
taking the junk
Erratic,
food.
erratic food
Yeah,
habits, erratic
so
food habits.
erratic. Yeah. So yeah.
Yes, all these things. So usually we tell them, see, we want to go for a pregnancy because they think that because of PCO they are not conceiving. But we tell
Okay.
them it is not because of PCO. Change your biological shift. You want to work
Okay.
for a company where your biological shift and full health is this one, you have to go ahead. Otherwise,
Hmm.
change. Maybe you get little less salary. This is what I say. But you work in a
Yeah.
this one where your circadian rhythm will be maintained. Then only your
Maintained.
will respond. Otherwise, ovaries are not, they are very dominant organ for a lady. They will
Yeah.
not listen to
Yeah.
you. I will do anything. I
Yeah.
will take alcohol. I will do that. But you give the egg. It will tell, no, I cannot give you egg. You be like this only. They will tell.
No, no, it is such a powerful. See, the endocrinal, the whole
Yes.
balance is
System.
so important. And
Yes.
when
Yes.
that balance is shifted and then there is an
Yes.
imbalance, the
Correct.
whole body becomes erratic and their every organ in the body, they lose their
Yes.
harmony.
Yes.
And
Yes.
I think ultimately you have described so beautifully what is the words that in a simple term you want to advise the youngsters so that
Yes.
they don't get this PCOD.
Yes. I would like to say polycystic ovary, whether it in the teenager girls or in the young ladies within 30 or 35, after that we usually don't see polycystic ovaries because the activity of the ovary itself will be less after 35, 40. So don't get
Hmm.
worried that you have a polycystic disease. It is not a
Hmm.
something which cannot be correctable. It can be easily
Hmm.
correctable with your disciplined way of living the life, with your
Hmm.
lifestyle following
Hmm.
where you will take a proper food and a proper sleep and you will bring down your anxiety with your own assessment of your life conditions. So with all that and you're bringing down this whatever the social bad habits like smoking and alcohol and taking non-vegetarian food all the time, that dead food where there is no oxygen in the dead food actually, depend more on the vegetarian food. With all these things, definitely this PCOS can be corrected and you can definitely look better without any pimples or acne. And married people need not put that because of PCO I am not pregnant. It may not be that. It may be some other reason is operating. Even your husband male factor also to be assessed. Don't get worried about that. Get into a proper consultant and get your PCO corrected where you are taking a proper rest. Unnecessarily bad habits are not there, and where there is a what to say like a disciplined life is there, PCOS will be definitely it will come down and you can
Yeah.
lead a very healthy life. There is nothing like infertility is because of PCO. and it can be
Oh,
diabetes because of PCO. Today's PCO, young
okay.
person can be future diabetic because the
Okay.
mechanisms are the same. Liver metabolism problem and also
Hmm.
the insulin resistance, both are same. So you have to be very careful. Your lifestyle changes should start from now only. Do the style in life, but live like a with a good lifestyle. What style we do,
Ah.
what style we go, that is different. But life should be in a style with a good discipline and a good food and a
Yeah.
good sleep. I
So
would like to
I
tell that
think
to all my
I think the
audience.
best example is Dr. Parimala Devi. She's stylish, but she has a good lifestyle. So the be stylish, but have a good lifestyle. The disciplined life, what you
Yes,
eat,
lifestyle.
how
That
you
is
sleep,
lifestyle.
the
Yes.
exercise and regular yoga, dhyana, meditation, controlling your stress and
Mindful
mind,
eating.
mindful
Yes.
eating,
One word, mindful eating
mind.
and mindful living. Mindful
Yeah,
living.
correct,
ಈಗ
correct, correct.
because we are getting in a party lot of lavish buffet spread, eat everything. Oh, so much is there. Not like that. Mindful eating, mindful living
Okay,
in a good lifestyle will definitely
excellent.
make us happy. And madam is a great inspiration for that. The way you are
Thank you
living.
so much. Thank you so much, Dr. Parimala Devi, because ultimately, how we live, it is
Yes.
depends on our mind. If our
Yes.
mind is strong and if we can control our
Mm.
panchendriya, we can lead a wonderful life and
Yes.
we can be totally without any hassles or diseases or problems. And our body will itself maintain the harmony in the hormonal balance will be there. So to have a good harmonious living, lead a beautiful lifestyle. Thank you very
Yes.
much for your
Yes.
kind and
Thank you,
beautiful
madam. Thank you very
explanation.
much for
Thank
the
you.
opportunity.